We can start.
Okay, so welcome everyone. I see we are quite a lot of us today, so thank you so much for spending the time with us. We're very excited today because we are about to launch something that we've been working over a year now. Before I start, I would like to thank the other speakers that are joining us. I would like to thank Maria La Sierra from WHO Europe, Jose Zuniga from Fast Track Cities, and I want to get this name right, Narmin Mostafa from the Egypt Presidential Initiative. Thank you so much for joining us in this journey that we've also been discussing, and we look forward continuing with you. So most of you, I believe you know SICAN, and Matthew, if not, will explain a bit more. But with next year is our 10th anniversary. There's been a lot of work over the last 10 years to crack how we improve access to cancer care from a full health system perspective. And you all know that we do it from the ground up, so leveraging cities, and it's a long journey. We spend a lot of time in the cities to actually start seeing and being able to measure what are those improvements in the system. In this journey of system transformation, there's been a lot of learnings. There's been a lot of learnings on how to implement things, how to adapt international standards to local contexts. There's been tools that have been developed to quantify cost, investment, budgets, many things. What do we do with those learnings? So, of course, we've been collecting them, but we felt it was time that, as you know, cancer cannot wait. There's a lot of demand out there. So, we're figuring out how we can share that knowledge. How can we support other countries that are already in this journey to improve access to cancer care, to speed up their progress, sharing our know how, our tools, and our support in implementation based on the learnings. So, this is where we are today. We are ready to share our knowledge. We're ready to share, to go a step beyond our core cities and support cities in a different way. And that's what we're going to be presenting to you is how we're going to support this new route, this new destination called SICAN Horizon. So with that, I'm going to pass it to Matthew, who's actually dialing directly from one of the new SICAN Horizon cities. So over to you, Matthew.
Thank you, Isabel, and welcome everyone to this webinar. So my name is Mathieu Moreau, and I'm a director at SICAN, and I'm leading this initiative of SICAN Horizon and this creation of this new initiative. So real pleasure to introduce this to all of you today. It's, of course, a big milestone for us today. So I just want to start reminding a little bit what is SICAN as an organization. And this here is why we exist, because we strongly believe, this is our belief, that where you live and who you are shouldn't determine the quality of the cancer care you receive. But yet we all know that it does. It does today more than ever. So we're taking action as an organization. We are a nonprofit organization based in Geneva, in Switzerland. And our mandate is to strengthen cancer care, building resilient healthcare ecosystems through implementation and collaboration across cities. And every word is important here. What's important is healthcare ecosystem. We only work at system level. We don't work at facility level. We are there to empower an entire system to work better together to provide the care that the patients need. The second keyword is implementation. We are focused on implementation support. We are not an advocacy organization. We're not a scientific organization. We're there to support implementation in the last mile to make sure that all the innovation and the solutions can reach the clinicians and the patients. And finally, across cities, because that's our mandate, to work at the city level for implementation. From the ground up as well is very important. Why? Because we activate the local stakeholders, we activate the city ecosystem so that the local stakeholders can drive change and can drive implementation rather than substituting ourselves to the local capabilities. I want to start here showing where we're present today. I know it's always a burning question. So our core city, our network of core cities is in 17 different countries. So as you see, we're very present in Latin America, in Sub-Saharan Africa, one city in Eastern Europe, and as well in Southeast Asia. Those core cities are applying every 2 to 3 years when we have called for applications, and we provide a long-term support to those cities. Why do we work at city level? Cities are always the great reflection of a country's healthcare system. In a city, you find everything from primary care level to tertiary care level. You find civil society organization, you find government body, public sector, private sector. So all the actors of a healthcare system are actually present in the cities. And this is where implementation happens. Very difficult to do an implementation at a country level. So our philosophy and our mandate is to support the cities, create an implementation blueprint so that the following cities in the country can then replicate and adopt what has been done as a sort of model city. This is the reason why we focus at city level. The way we partner with cities is always through two big phases, whatever we do. The first one being about uncovering the gaps, and the second one about powering the system. What does it mean? Uncover the gaps means first activating the community involved in cancer care in the cities, making sure they all know each other, they can work together, creating mechanisms of collaboration, then collecting data within that ecosystem to really make sure that the right interventions are designed to address the real world problem of the cities. And then powering the system is when we help them cultivate implementation excellence, adopt best practices of project and program management to make sure that all the projects and all the solutions that they want to implement can go to the end and really reach the patients and the clinicians. And then afterwards, we've seen that that has a ripple effect and that can push policy change at a regional or national level. And we also have a huge focus on knowledge sharing and knowledge creation. Our CCAN model, because we are operating all along the continuum of care in cancer, require partnerships. As you can imagine, we cannot be expert in everything cancer care internally at CCAN, being around 50 full-time employee organizations. So we work with technical partners, which are foundational to our model, and we match the expertise to the needs of our cities. Going quickly through the type of partners we work with academic and cancer institutions. So here you would see leading cancer care provider, both from the global north and the global south. I think that's also very important, who are providing experts, depending on the thematic area, to the projects we support in cities. We also work with international organizations and professional associations. A lot of different ones. I would quote WHO because today we have a representative on the call of WHO. We are an implementation partner of WHO. We will also work, for example, with the IAEA on all topics related to nuclear medicine, radiology, or radiotherapy, and a lot of professional associations providing great expertise and support. And finally, we work as well with the industry. So we're not shy of working with the industry as a nonprofit organizations, and we would work with the main providers of oncology products. We know it works, and this is why we can now afford to expand into a different model of CCAN Horizon. We know it works. We've done more than 214 projects, which we call solutions in cities. We've trained close to 6,000 healthcare workers, and we've reached close to 1 million patients with our solutions. We've also demonstrated that our model increased political commitment and increased multi-sectoral collaboration for more effective project delivery. We've also have numerous evidence of documented improvements of care and outcomes across our cities. But now, we've seen that our core cities, those 17 core cities, which work with us for a long period of time, they engage across the entire continuum and over several years. Together with those core cities, we keep developing implementation solutions that we try to standardize, that we try to learn from. And we always had the ambition of developing those solutions for the whole world. Yet, we see that generating knowledge is not sufficient to create impact across geography. Many health systems have come to us and have asked for hands-on support to help with this knowledge transfer. They want support to localize and implement in their local ecosystem what has already worked elsewhere in the network of CCAN core cities. This is a challenge that we try to solve and we've been working on for the past year. And this is why today we are proudly introducing this new model of collaboration, which is a complementary model, which we call CCAN Horizon. which aims at really translating implementation know-how into tangible system improvements in new geographies. What is the model? I think you've already understood it from the different intervention from Isabelle and what I said, but we really build on our 17 core cities. The 17 core cities, along with CCAN, have produced proven implementation methods and evidence of what works. We have also developed technical resources, which are coming from those close to 10 years of implementation experience, which are standardizing and guiding the way implementation could be run. And we've also worked with a really strong network of international experts, both coming from our cities as well as our partners that I mentioned before. Based on this, we felt comfortable to be able to transfer those proven implementation methods with the support of those experts to more geographies that we now call horizon cities. All of those are always now transferred through a customization of an implementation model. So we co-create with our horizon city the adequate implementation model so that all of those resources and know-how can be transferred in the adequate way. And we also believe, and we'll see that happening hopefully in the next few years, the power of getting much more feedback from the solutions coming back, I would say, to our core network. We have classified also our know-how so that it gets a little easier for our counterparts to understand where we have implementation expertise. So we have classified that across 18 implementation areas. So it's a lot. It's across the whole continuum. And we've created 3 buckets. A bucket of city preparedness, how to prepare a local system to do implementation in a cohesive and well sort of coordinated way. For that, for example, we are able to support with stakeholder mapping and assess and engagement, which is actually a very difficult exercise, is what we've learned over the year. To support with cancer needs assessment, really how to do facility-based needs assessment, policy assessment, and get insights from the patients and the civil society organization, so that from all of those point of views, you get the right data to assess your local cancer care system and the gaps and prioritize what are the solutions. The third aspect is the readiness of a local state system to drive city level implementation. Then we have a second bucket around health system management, where we would have expertise in implementing solutions in cancer registry and data systems, in cancer management guideline development and implementation, in cancer financing, how to improve the financing landscape, and in digital health transformation. And finally, we have, I think, and maybe that's even more core in terms of patient care delivery. We have solutions in system navigation and coordination of the system, in pathology and diagnostics. So across pathology, imaging diagnosis, and nuclear medicine, in treatment across radiotherapy, surgery, and systemic treatment, but also in supportive and palliative care and in early diagnosis practices, which are obviously very core topic. So we are able to now customize specific implementation support programs for new horizon cities all across those different areas. So this is a network that I've shown you, which is growing. We keep growing the core network of city. On the 4th of February, we actually announced our 17th core city, which is Quezon City in the Philippines. But also, we now are launching a network of horizon cities, right? And we've already been working with 4 different locations. The first one of which was in Uzbekistan, and we have actually a speaker who is going to talk about it today. Then we also launched Vietnam and Indonesia. So in Indonesia, where I'm actually currently located, as Isabelle mentioned. And finally, the latest one with whom we're working to launch the first Horizon project, which is in Egypt. And we also have a first speaker. We have a speaker today who is going to talk about it. So we really hope that this network can grow relatively fast. We have a lot of demand. Now it's always about understanding how to best shape those programs, which are complementing our core city network. What are those 4 new places working on? Just very briefly to give you an idea. Uzbekistan, I won't get into the details because Maria is going to talk about it, but it was on national cancer management guidelines. In Yogyakarta, it's to work towards specifically access to breast cancer care. In Da Nang, Vietnam, same. It's also to work on access to breast cancer care. And finally, in Cairo, and again, Dr. Nermin is going to talk about it, but it's to focus on pathology strengthening. So as you see, those interventions are way more focused than in our core cities, and by default will be shorter term. So those are the key principles of a CCAN Horizon engagement and collaboration between CCAN and a local system. It needs to be, as for our core city, under an agreement with public health authorities, right? So we would not work unless we have a clear agreement and a clear mandate from the public health authorities. It needs to be a focused intervention based on local needs, not looking at all the system for all cancer sites the way we look at for core cities. It needs to always use our city engagement process framework, the one who are familiar with CCAN, who know how much we cherish and how much is important for us, this process, which is really the base of how we drive implementation. We use it, but we use it in a streamlined way to fulfill the needs of that specific intervention that we would deliver in co-design. The delivery always remain at city level. That's both our identity, but also how we feel is the most effective and impactful way of delivering implementation support. We would also, and that makes a difference, empower a local implementation partner as much as possible. So really work with a counterpart in country and empower that implementation partner to be, in a way, the local CCAN, right, from the beginning. That could be an NGO, that could be an academic institution, or that could even be a government body. But all possibilities are open, and this is the type of customization and dialogue we have with the cities who want to engage with us as an Horizon city. And finally, and this is a big difference, it only works with dedicated funding. So our core city model is using a system of funding, of pooling funding, right? Clubbing resources so that we can allocate resources all across that network. With CCAN Horizon, we need and we will only intervene in CCAN Horizon cities if specific resources, financial resources, can be mobilized to deliver that technical assistance. I will stop here with my introduction of CCAN Horizon. I think those are roughly covering the main principle and the approach. I hope it gives a bit of light to the audience. And I would love to now pass it on to our speakers, who are in all different capacities representing the way we collaborate with partners on this modality. And I want to start with Maria La Sierra from WHO Euro, who is going to tell us a bit more about what we work together in Uzbekistan. Maria, the floor is yours. I'm sharing your slide. Just let me know when you want to move on to the next slides.
Thank you, Matt. It's a pleasure to be here. I wanted to present a case study of an experience that we've had in terms of collaboration between WHO and CCAN. If you can go to the next slide. So very briefly, WHO is divided at 3 levels. There's WHO headquarters, there's 6 regional offices, and then there's country offices. And I'm speaking now from the regional office perspective. I work at WHO Europe, which covers 53 countries. Next slide, please. And so from WHO side, we really try to support countries in implementing evidence-based practices. And when it comes to cancer specifically, this is just an example from the NCD Best Buys. And this is where our support is focused on. Next slide, please. And you can actually press next slide already. So it's fully, thank you. Besides those evidence-based policies that we try to support countries to implement, we focus on 3 global initiatives, which you might have heard of. There's the Childhood Cancer Initiative, the Cervical Cancer Initiative, and the Global Breast Cancer Initiative, which has also been alluded to previously. And within these 3 initiatives, we support countries along the continuum of care, from prevention to palliative care, but also including governance, such as national cancer control plans. And so the only reason why I'm presenting this, which might be familiar, is just to say that there is a lot of country requests, and they are very vast in their nature. Next slide, please. So for that, in order to be able to support countries in all the different needs for technical assistance, it is really important for us to count on our partners. WHO, there's not many employees for the cancer team, so we really need to rely on our great partners that we can count on. And so City Cancer Challenge and WHO have had a memorandum of understanding signed for some years, which makes the collaboration even easier. And now I will speak from the regional perspective. We had experience with CCAN in terms of implementing the Global Breast Cancer Initiative framework in Tbilisi as one of the core cities. There's an action plan that was decided on and it's been implemented together. And as well as, for example, there was development of requirements for institutions to be able to provide surgical and treatment services. So we had a very positive experience when it came to the core cities. Then we had a different situation, which is also new for us. We had a country asking us for support. It was Uzbekistan. They had a big investment project for cancer that was mainly focusing on building hospitals and purchasing equipment. And there was a request from the donor to make sure that there was what they call the soft component also included, which is basically all of our work, which is developing policies and supporting technically, improving, doing trainings, improving the skills of the professionals, etc. And so we have an agreement with the Ministry of Health, and just to say that this is only 5% of the big investment that was given for cancer. But even though it's only 5%, for us it's a big project. It covers 10 deliverables from the National Cancer Control Plan to palliative care, supporting, improving care for cervical, breast cancer, diagnostics, treatment, etc. So it is a very comprehensive project, and it spans 4 years. And so we ran into the situation where there was a specific activity, development of resource-appropriate guidelines for invasive cervical cancer and for breast cancer management, which was a first time to be done in that way in the country. And so for us, it became really challenging to be able bureaucratically to hire all the experts that you would need to be able to support that. And so we decided to have a public tender, trying to find a partner that could implement that specific activity. And so in July 2025, CCAN was selected. And as I understand, we were one of the first in this new Horizon Cities project. And CCAN then went on very quickly to recruit and select 16 international experts. There was eight experts for breast cancer, 8 experts for cervical cancer, that had 3 important criteria. One of them was that they spoke the same language as our national professionals. The other one was that they understood the context that they worked within. And the third one was that they had experience with developing such resource-appropriate guidelines. And so this is really important for us because we want to make sure that these guidelines would be actually used in the country and that they were appropriate for the resources that are available. And as well, there was a consultant coordinating this whole process. And currently, these guidelines are going to be submitted in this quarter. So in the next month, they will be submitted. The work has been finalized in terms of the collaboration with CCAN. They have been presented to the extensive national counterparts. And so soon it will be submitted. And it has been a very positive experience because CCAN was able to respond quickly to our need. Once you agree to implement a big project, there's a lot of pressure. And guidelines is one of the cornerstones of the later activities that you have to deliver. Because depending on what is decided for protocols, you will decide on certain trainings or other trainings to work on. And so for future collaboration, I would say that importantly, we would still appreciate the collaboration to implement the Global Breast Cancer Initiative, because that's a big project for WHO and something that we're really trying to push through. And we have a lot of country requests for that. But also, it would be great to have these similar experiences where we can collaborate for activities, specific activities that CECAN has had previous experience with in doing, because that way they were able to respond very quickly. So that would be great if those future projects can continue to happen. And that is that is the scope of my presentation. But back to you, Matthew. Let me know if there's any questions or anything you'd like me to add.
Thank you so much, Maria. And actually, it's a good opportunity to flag that we have a chat function. So I would like to encourage the audience to drop the questions in the chat. We have a Q&A session at the end, and we will really appreciate to have all the questions already written then. So please drop your questions as they come through your mind, and we will address all of them. And in the meantime, I'd like to invite and thank you, Maria. And then we'd like to invite our next speaker, who is Dr. Nermeen Mostafa from Egypt, from the Presidential Initiative of Early Detection and Management of Cancer.
Thank you so much, Matthew, for the introduction and for giving me this great opportunity to join this important event and important online meeting to launch about the great project, which is the Horizon Cities. First of all, let me introduce myself. I'm Nermeen Mostafa. I'm clinical oncologist at Ain Shams University and clinical oncologist at Gustave Roussy International Egypt, and the head of awareness subcommittee of the Presidential Initiative of Cancer Early Detection and Management that had been launched in June 2023. Briefly, we are having 18 presidential initiatives and health projects. 2 of them are concerned about cancer, the Women Health, which is concerned about breast cancer, and the recently joined our presidential initiative regarding cancer and early detection and management that covers the colon, cervix, prostate, and lung. Yes, and a small introduction about the recently joined Presidential Initiative of Cancer Early Detection and Management. It had been launched in June 2023 to join the great umbrella of 100 million healthy lives that have the 18 presidential initiative and health projects to enhance the mission of this health project, presidential health project, to enhance the health and well-being of the Egyptian population, the 100 million lives, by implementing comprehensive cancer screening and early detection programs, ensuring equitable access to preventive services, and reducing the cancer-related morbidity, mortality in alignment with the WHO guidelines and the United Nations Sustainable Development Goals, and to have resilient and inclusive healthcare system in Egypt, where all individuals across the 27 cities of Egypt to be empowered with, regardless the financial status, any other social, epidemiological factors, to have the same equal access to the treatment for screening and preventive and early detection service, to leading to a significant reduction in cancer incidence and mortality, and contributing to the global efforts and force to eliminate cancer as public health concern. The main 8 pillars of our presidential initiative are 8 pillars with awareness, early detection, diagnosis, management and survivorship, data management, and center of excellence, to have a center of excellence for the 4 disease area and to be referral center and hub for the rest of cities and extending beyond Egypt, and training, building capacities for the all healthcare professionals, and research to implement data. As I have said about the goals of the presidential initiative, we are concerned about our project, the pathology strengthening and building capacity, which was aligned with the strategic goal of the presidential initiative through standardize and improve the quality of diagnosis and treatment and survivorship care through implement standardized diagnostic and treatment pathways for the 4 cancers aligned with the international best practice, but adapted to Egypt and our special limited resources services, and ensure that confirmed cases are discussed in a multidisciplinary tumor board to receive the best standard of care and managed according to the guidelines, and integrate the survivorship care as we're now trying to prevent cancer and detect an early detection through tertiary prevention and the diseased patients to receive the standard of care and to improve the outcome and survival, with the rest of the scope of the survivorship care through rehabilitation, psychological support, and for the palliative cases as well. Next, please. Yes, and the collaboration are the areas for the data management system to include and informed decisions, better visualization of data and figures, and faster the identification of the gap and challenges, awareness and capacity building through having a medical convoys on spot for screening, for public awareness, for trying to reach to people to their working area, and especially in the bigger cities that they don't have time to go to the primary healthcare units to do the screening and early detection. So we're trying to have this mobile convoys and trying to reach to the precision medicine and molecular testing through improvement the infrastructure labs and having better quality of the service provided through better precision medicine and better outcome, and optimization of the process through the starting from the sample transfer and qualified the medical team, and to ensure accurate lab testing and better diagnosis and management, as well as data storage and analysis through customized servers and optimum data usage. So why pathology? As we all know that it's the root of the diagnosis, that when we have a good diagnosis in an optimum time, we will reach for right treatment, better outcome, better survival, and save a lot of lives. So it's the foundational pillar of any effective cancer care system to reach and underpins diagnosis and treatment planning across all cancer types. So high quality, accurate, and timely anatomic pathology diagnosis is essential to inform appropriate treatment decision, ensure optimal patient outcome. A weakness in the communications with and with the pathology service can undermine the entire cancer care continuum and limiting the effectiveness of clinical decision-making and reducing the impact of investment made in other areas of cancer care. Next. And after a great support from the great CCAN team and a lot of communications and meetings and their guidance, how we can work together in this project, which is the pathology strengthening and building capacities through different pillars of the proposal, including the stakeholder engagement and technical working group and committee establishment, and pathology system situation analysis, quality management system development, and to have pathology development plan for Cairo and be center of excellence and hub for the rest of cities, and capacity development and change management. And this is finally. Next. And this is my final slide to have this memorial picture with the great CCAN team during their diligence visit for Cairo, with Dr. Mohammed Hassani, the assistant assistant Minister of Health and Population for the Presidential Initiative and Public Health, and Dr. Khalid, the Executive Director of the Presidential Initiative for Cancer Early Detection and Management. And thank you so much.
Thank you so much, Dr. Nermeen. So we got a perspective directly from a country that we work with. So thank you so much for that, after our technical partner, WHO. And finally, I want to leave the the floor to Jose from Fast Track Cities. I think it's a very different type of partnership, so I think it's also an interesting perspective. Jose, it's all yours.
Thank you very much. My gratitude to Isabel and her great team, and I'm delighted to be here and congratulate you on the launch of CKAN Horizon. Next slide, please. So as Matthew noted, I am with Fast Track Health. Fast Track Health is a global health organization. It is focused on communicable and non-communicable diseases, as well as the health impacts of climate change. We support a global network of 600 cities that we launched in 2014 with 26 initial. We're now at more than 600 cities and municipalities across every region of the world. In several countries, we have a critical mass of fast-track cities so that if we are successful in the urban health initiatives that these cities are advancing, we have national impact. We work through partnerships, which is why I'm delighted to be here. And our partnership with CKAN is an example of the partnership framework under which we operate. Our MOUs include MOUs with the UN agencies, including UN Habitat and across departments of WHO, but also, as I noted, with CKAN and other urban health initiatives. Our focus really is around data-driven accountability to ensure equity of access to innovations and health services, community engagement, really predicated on our work in the HIV space and the mantra of nothing for us without us and the rights of the city, but also the importance of political leadership. And as I'll get into later in the presentation, the engagement, active engagement of mayors and other health elected officials is critical, and it's something we try to sustain. It's obvious why we work in cities. I think CKAN understands that too. You know, with 60% of people living living in cities by 2030, we have a geographical advantage to have maximum impact. But it's also an opportunity to leverage urban laboratories of innovation. These cities and municipalities can operate much faster and have operated much faster in integrating innovations and/or creating their own. And in that respect, the city advantage is clear. Next slide, please. So we operate across the continuum of care for several disease areas, and there are discrete initiatives that we engage in, whether it's high dollar, low dollar, mid dollar interventions. I'm citing three here that I think are most relevant to our partnership with CKAN. The first are data initiatives. I mentioned we're equity focused. In that respect, a part of joining the Fast Track Cities initiative is a requirement that cities and municipalities share data. We work to urbanize and socialize global indicators and targets, providing technical assistance to health departments at whatever jurisdictional level is relevant, to then report their data on an annual basis, visualizing them on open access dashboards, so that we support an accountability framework for progress or the lack thereof across targets and indicators. We work with, as CKAN does, professional, medical, and other associations to build capacity through training and other methods to ensure that we can strengthen person-centered referral pathways and optimize HIV and other care continuum across the network of cities. This includes provided rapid guidance around innovations, and as important, our current work around how do we leverage digital health and health AI at a time where we have significant strain on the health workforce. And then finally, we do engage in a significant amount of policy advocacy at the local level, national, regional, and global. And in that respect, we work with our cities through community engagement of the health departments, and engagement of mayors and other elected officials to develop implementation plans, track progress, and then report that out through various means. Next slide, please. What excites me about our partnership with CKAN outside of the potential impact is that we have an opportunity beyond the core cities and the horizon cities to ensure that a high tide lifts all boats. It is important to us as a Fast Track Cities network that we partner with organizations like CCAN to amplify best practices, to amplify resources that have been developed, and in this instance, models that could be implemented locally to improve care, in this instance, cancer care. And so in relation to knowledge exchange, we're excited about sharing the best practices that have been documented already, looking through an implementation science lens at what is feasible and scalable in other cities around the world. As important, looking at the capacity building and technical assistance aspects to implement cancer care models across a broader subsection of cities, obviously contingent on resources. And then to build what we've built successfully at the outset of this initiative, which was originally exclusively focused on HIV and now has expanded its remit to create communities of practice through ongoing virtual and in-person collaboration. Again, to identify where there are cross-cutting challenges and cross-cutting opportunities to optimize cancer care. So thank you to CCAN for this exciting work and for partnering with us. We're very excited about the future.
Thank you, Jose. And we're also very excited because I think joining forces expands, I would say, the way we can provide technical assistance to a much broader network of city, much beyond, I would say, the city and core cities. So I think we're really excited on what comes ahead with this partnership. So finally, I just wanted to share a bit very concretely for whoever is here on this webinar, some guidance on how to engage with CCAN Horizon, right, at this new initiative. So first, who should engage with us? Directly local government authorities. I mean, if there are needs of technical assistance on cancer care system strengthening that you have a clear strategy and you're looking for implementation partners, this is the type of support that we can provide. If you're also strong frontline leaders, so clinicians, key opinion leaders, or strong civil society partners in countries, same, identifying the same type of technical assistance opportunities, we're really happy to get into conversation and see if we have the expertise, if we've already done such kind of projects before, and how can we do knowledge transfer to you. Finally, from technical partners, such as WHO, but many others I'm sure are on the call, if you also have, I would say, conversations with countries and you see needs, I think it's the right thing. And then finally, funding bodies. If, again, you are in conversation with countries about supporting a particular cancer care project, but you're missing the right technical assistance, this is where CCAN comes. So again, I think just to repeat, so health authorities, your health system is looking for technical international cooperation. If you're frontline health professionals, you're looking to develop a strong care strengthening project to be submitted to the authorities. If you're a technical partner, you're looking for a last mile partner to support the implementation of or complement an existing technical cooperation project. And if you're a funding partner, you're supporting a country and a city health system, and you're planning to, and you look for an implementation capabilities to complement the local stewardship. So this is really the when, who, and when, and we would really welcome anyone, again, to have conversation with us. And the big question for the audience is, what can CCAN Horizon help you unlock? And the call for action is, let's connect. Let's have conversation to see how we can jointly design projects in further and in new CCAN Horizon cities. Now I'll pass it on to my colleague, Derek, who has been carefully watching the Q&A and to let me know what are the questions that we should reply in the few minutes which are left.
Thanks, Matthew. I've spotted that Isa has started answering some of the questions. But I think what's interesting, two main questions here is on who mobilizes the funding and can CCAN help with that. So how do we do that? That's on funding. The second one is on operating in multiple cities within the same country. So let's start with these two. Thank you.
All right. So on the funding approach, this is why the funding comes from different angles. So we have some strategies if the requests come from government authorities or frontline workers, we put together joint fundraising strategies, right, to do a joint reach out and do mobilization of resources specifically for the budget which has been designed for this cooperation. The countries already have collaborations. The country sometimes has budgets available as well for implementation. It has been the case in several of our conversations. So it's really figuring out, in this case, where can the resources come from? And we put together, we invest time in putting together the right resource mobilization strategies. In some cases where it's another partner, so for in some cases, direct care funding partner is reaching out to us and saying there is an availability of budget. So in this case, we're happy to work with that, but then we need to guarantee that we have a mandate of the public health authorities. So there is no single answer. This is very customized, how I think everyone is doing fundraising these days, but we really rely on joining forces with the country authorities. This is definitely not an offer where we come with a white check on the table. So we need to do joint fundraising, and the partner local counterparts need to work with us towards this. And the second question was around multiple cities in the same country. That's correct. So I think the first piece of the question is core city network. There's only one per country, right? And this is definitely intentional, right? So we never wanted to have two core cities in the same country. I think I explained the philosophy of having a blueprint city, a model which can then be replicated within the country. So it would not make sense, speaking again of the concept of the urban laboratory, to have several urban laboratories in the same geography. However, now that definitely changes with the Horizon City approach. And then in that case, it will not be a problem to have potentially different cities in the same country. With specific Horizon approaches. It could be different cities working on different things, or organizing straight away a knowledge transfer from one city to the other. And to be completely transparent, that's exactly the type of conversation we're already having in Indonesia, to organize a knowledge transfer from Yogyakarta to potentially another city in the country. So that also opens opportunities in working in multiple cities in the same country here.
Matthew, there's one more interesting question, is that how does CCAN establish local presence?
Okay,
I think this is the city program manager part.
You want to answer this one, Derek?
No, over to you.
Okay, so local presence. So that's a multi-layered aspect. We always work, and that's true in core cities, but also in Horizon City, under a local governance. In some cases, we would establish, just like in our core city, a city executive committee, which is a committee, which is an interinstitutional body, governance body, representing the main decision makers within the city, who has the accountability of driving process and driving project. This is one of the key, I would say, success factors of the CCAN implementation methodology, so that the ownership is really local. That body always have government representation, key facility representation, and potentially as well civil society organization. So this is the first layer. Then the second layer is at the project team level. So the doers who are really doing the project, they are project teams which are made of local stakeholders, and which, again, it needs to be teams which are interinstitutional. So that doesn't change compared to our core model. We also have, so in terms of staff, we ensure that we always have one coordinator per city, city manager, city program manager, depending on the nature, again, of the initiative. So we would have one staff or one consultant. I think Maria mentioned there was one consultant coordinator for the project in Uzbekistan. We have one in Danang, we have one in Yogyakarta. So that's like the one staff able to coordinate really all the efforts. And then in terms of agreements, this is again customized. Either we have directly MOU with the local authorities, or we rely on an existing MOU which already exists between a partner we work with and the local authorities. And finally, the last layer is working with an implementation partner. I think this is very specific to the CCAN Horizon approach as well. It's to always rely on an implementation partner who is an established institution in the country. And our aim is to empower that institution to do what CCAN knows how to do instead of necessarily doing it ourselves. So I think really a multi-layered answer to make sure that we have a country presence, which is not invasive, but which is to help organize and structure how the country already functions.
Another interesting one is on a country having already a strong national mandate or initiative, and how does the city implementation or initiative aligns with the national mandate?
That's actually the perfect case scenario. That's what we love, because there is already clarity, there's already a strategy, and what needs to be done is like implementing it. So that's the absolute perfect scenario. There's a really strong NCCP, or there's a really strong National Breast Cancer Action Plan or Cervical Elimination Plan, and then the counterparts need to make that a reality within the particular geographies. And so we would take that program and either identify which are the projects which require help, or help structure this plan into really implementable projects, right? Because it's a plan, we always say, oh, it's easy to implement a plan now that it's there. Actually, no, it requires so much coordination work to make it a reality. So I am more concerned when there is no national strategy and no national plan. That's a more difficult case. But when there is a national strategy, that's a perfect case scenario, because we write and we ensure that this is really being implemented.
Next question is on knowledge transfer within the country, and how does the city expert come, like going to other cities to support? Yeah.
Knowledge transfer within the country? Yeah.
Yeah.
So that's something we're still experimenting. So this, we don't have yet sort of experiences to share, but we really, that's actually one of the reasons of my trip to Indonesia this week, is to organize that and co-create such kind of solutions. It's definitely about orchestrating the mechanism so that the local implementation partner in the first city, or the local city executive committee in the first city, can play a very active role in transferring knowledge. But we're also very much aware that it still requires local coordination. It requires feet on the ground. So I think it's always a combination of having those feet on the ground very well organized in the second city or the third city, while having those core partners in the first city who can mentor, who can support on a regular basis, who can share the experiences, share the tools, share the software, share the how to guide they've developed, share the output they've developed, so that the second city gains time, doesn't have to reinvent the wheel, and can reuse what has already been done. I'm thinking, for example, if a project is about, like what Nermin mentioned, there's a lot of potentially standard creation, right? Like quality standards manual. When you have that, it's possible for a city to share those existing manuals to the next one, right? Instead of recreating, so that the next one only focus on raising awareness, building capacity based on those existing manuals. So I think there's a lot of opportunities. This is still a model that we'll need to streamline, and we'll test, we'll learn, and we'll refine how we make that model work of city to city knowledge sharing within one country. From country to country, this is already the case. The project of Uzbekistan that Maria relied, it was a strong case of support of Tbilisi in Georgia, which is our core city, sending experts to work with the expert in Uzbekistan. So a very good example of how city to city knowledge transfer in a very tangible and practical way can happen and can be organized.
No active questions for now, Matthew.
Okay. I'll share again quickly the screen for if people have still want to reach out and haven't been able to capture, I would say, the coordinates, the contact details. No further question? Nothing. Okay. Isabella, you're still here. Do you want to give a bit of a closing?
No, I mean, well, as I'm here, thank you everybody for your time. I hope this was insightful for all of you. We are here for all questions, but also suggestions. We've heard some of you willing to explore opportunities of support in your cities. And yeah, we're looking forward to what this next journey will take us. And also, I would like to thank all our current partners that are in the call for your continuous support always, and of course the speakers. And finally, Matthew and Derek, who are leading this work. And it's just such a, it's amazing to work with both of you, really. Thank you. Great work.
Thank
Great
you.
work. Yeah.
And then we look forward to hearing from all our partners and prospects who want to, again, explore how we can support with the Seek and Horizon modality. Thank you, everyone, for joining today. And thank you for our speakers.
Well done. Ciao.